Oh, hey, Mary Martha, Miracle. Whoa, whoa. Hey, nice. What are you guys doing here? Just sitting, hanging out, or what?
No,
Yeah.
this is actually, it's Wednesday and it's 1 o'clock, so it is community health
Ooh,
worker time.
Leo's open hours. So we're filming this right now in this corner of Leo's, which, Miracle, why did you talk about like what used to be in this corner, what we were trying to do with this corner,
So if you look over
initially?
here, there's like this little resource desk. This is a relic from what used to be here. This used to be a giant table. Oh, actually, it was this one over here, this middle one.
Oh yeah. We started with this one, yeah.
It was right over here,
Yep.
and then we
Yep.
had all of this stuff on it, and a place where people can come and find resources for a healthier life. But now it's transformed into a career. It's transformed into a CHW role, which stands for Community Health Worker. And yeah, now we have an actual place where you can come and talk to professionals, find good resources for yourself.
Mary Martha, what is a community health worker, CHW?
They are the liaison between the medical and social services. Basically, they bridge the community between the resources that are out there to try to increase the health of the community members.
Yep. And so we started this program now, really January is when we kicked things off at the start of the year. And that started with us getting you guys set up to be doing a program with ASU. So you guys want to talk about the ASU program that y'all are doing right now?
Yeah, so we're working towards getting like a certification in this type of thing. So right now we're still taking on clients in a apprenticeship, but also while we're doing the apprenticeship, we're also doing a online course with the University of Arizona.
Yeah, and their goal,
or Arizona State University.
Yeah.
Sorry.
ASU, yeah. So their goal is that they want to increase the number of CHWs in Arizona by giving them the skills needed. So we got to be involved with this program and utilize it here at our own local community center. So can't be better than that.
Yeah, and then also through Pinal County at work, they are realizing how important this role is, that they were willing to create a program to pay CHWs in training to be compensated for their apprenticeship hours, right? So they're a partner that we're working with in this too, and they're investing directly into our community by paying you guys, right?
Definitely.
Yeah, definitely. Great resource.
Yeah, and so for those who might be interested in like finding more out about what y'all are doing and how you can help, like maybe just start with saying like who should contact a community health worker in your opinion.
My personal opinion is that everybody qualifies to speak with a community health worker because everybody's important when it comes to a topic of health, regardless where your financial status is or where professionally, whatever you're doing. I feel like everybody might have a need to communicate what's going on with them. So that's me, and it's a great ability to be able to reach out to your community members and check in with them and see how they're doing.
Any final points to say that you want to leave us off with?
This should be everywhere. Like, I think it's starting to build the community component that is like lost around like health and like taking care of yourself, taking care of your neighbor, taking care of the community you live in, so that we're all healthy. I feel like it starts to connect community members to each other and feel the fact that like we're in this together. We're a community. I'm a community member helping another community member. So I think it just all comes back to like helping the community members helping each other.
And then one thing that stands out to me is a lot of times we depend on the social services or the health professionals to provide all the guidance about what we're dealing with, when it's not really their position to do that. That's like extra. And a lot of times you find like people out there that are willing to help, but that's what we do. So that we are those people to help explain those elements even further, talk about treatments, talk about resources. You'll be surprised on all the ways that community health workers can help you.
All right.